like more like when people are like calling you. So they are just asking like general questions, or they are asking like related to the financial question, because most of the time people have the financial question like how they will manage the money when they find out senior care options, or they are more looking towards like the best fit senior care options.
I think financial, talking about or asking about finance, there is nobody really that, I mean, it's rare when somebody calls and they're asking straight right away about finances, you know. Um, by far, in most cases, people they ask questions about the senior living options out there because they just don't know anything about it.
Okay.
And so it's like I got like one of those calls, my father is 95, my mother is 92, they're living at home, they got some memory issues, they start needing help, we don't know what to do. That's kind of the bottom line of
Okay.
uh, the purpose of their search, I think. And then we go from there. And of course, at some point in the conversation, we'll talk about finances because that would narrow it down or expand it depending on their financial situation. But but generally, it's the lack of knowledge that most people have about the options for senior living. That is kind of, I think, the
Okay.
main thing.
So in that scenario, like they have like their parents have some memory issue. So did you directly like targeted the assisted living, or did you tell like which one is the best fit for them and they need to be look for those kind of facilities?
The first step is that I need to learn about them. I need to learn about the situation. What is their story? What are the challenges? What is the reason that triggered them to get online and do a search?
Okay.
So we start from there. And then once I learn about them,
Mm.
and the learning process expands. It starts with their story, what is their immediate need, what would be a secondary need, what is their financial situation, what would be the geographical area they want to be in, what are, uh, if the family members are involved, what is the location of the family members? Um, are the parents making their own decisions? There is somebody else in the family making decisions for them. Are the parents part of the process? Do they know that one of the kids is searching around and looking around for try to find options for them either to move out of their home or to find some kind of a help? That is important to know. And and so once I get the detail, the broad picture of their situation and their story, then we can start talking about what kind of option out there would be a good match for them. And the idea is not to find an option that is good for them like right now,
Mm.
but to find an option that is good for them now and in the future.
Right.
And um, and then and then we see it. Maybe if it's an assisted living would be a good option for them. Maybe it's an adult family home. Maybe a memory care. Uh, so we go from there.
And like when you're recommending like any kind of senior care options, so the people also like take a consultant from the doctors as well. Like they also recommend like that kind of facility they need to see, or according to your experience, you suggest them, okay, this one will be the best for you.
Well, doctors they always have a recommendation. Seems like, and it is accurate in most cases. I would say the doctor's recommendations. But I do find that many times when we get into the details of the story and the details of their needs and thinking to uh, trying to plan long term, the conclusion sometimes it turns out to be a little bit different than the doctor's recommendation. For example, finances, when they talk about with their doctor about their issues, their problems, their challenges, they talk only about that, but they don't go into details of their financial situation. When they come and talk to me, we talk about their challenges and everything, but then it turns out that there are no funds available or there are very limited funds available. So that kind of changes the direction of the approach sometimes completely. So um, that is the reason why in my conversations with the families, we get into the depth of the details to make sure we're making the right choices and we're going the right direction.